Now this topic is for respiratory acidosis. First, the causes of respiratory acidosis. Causes. Respiratory acidosis is caused by decreased alveolar ventilation, decreased alveolar ventilation due to retention of CO2, retention of carbon dioxide, impaired gas exchange, impaired diaphragm muscle, emphysema, then asthma, and impaired respiratory control in brainstem, then smoking. रेस्पिरेटरी एसिडोसिस में होता ये है कि कार्बन डाइऑक्साइड की रिटेंशन ज़्यादा हो जाती है ड्यू टू डिक्रीज एल्वेओलर वेंटिलेशन। रिटेंशन ज़्यादा हो जाएगी ड्यू टू इम्पेयर्ड गैस एक्सचेंज भी इसका कॉज है, और इम्पेयर्ड डायफ्राम मसल, एम्फाइसीमा, एस्थमा, ये दो डिजीज़ हैं, इनमें भी रिटेंशन ऑफ CO2 हो जाती है। इम्पेयर्ड रेस्पिरेटरी कंट्रोल इन ब्रेनस्टेम एंड स्मोकिंग इज ऑल्सो द मेन कॉज। नाउ कम टू द सिम्टम्स ऑफ रेस्पिरेटरी एसिडोसिस। Symptoms: hyperventilating, shortness of breath, fatigue, chronic exhaustion, then headache, drowsiness, confusion, and sweating. These are the signs and symptoms of respiratory acidosis. Now comes to the compensation of respiratory acidosis. Compensation of respiratory acidosis. There is no respiratory compensation for respiratory acidosis. No respiratory compensation, because the respiratory system is itself disturbed. In acute respiratory acidosis, renal compensation has not yet occurred. But in chronic respiratory acidosis, renal compensation has occurred. That is renal reabsorption of bicarbonate ion. And in respiratory acidosis, bronchodilators are given. Inhalers are given. And steroid drugs are given. Steroids. Now this was the compensation of respiratory acidosis. This is the main topic of acid-base patterns.